Hi, this is Dr. Ash, Director on Global Emergency Medicine Training Program. Today I'm going to talk about FCPS training program, UK training program, and LGEM training program. It's very important video, and I'm quite sure that after this video, all your doubts, all your questions will be answered. Let's compare these three programs and what is this all talk about LGEM, why so many doctors are joining us in such a short time, 400 plus trainees in one training program from all across the world. What is this going on and what are we doing? How we can compare ourselves with the national training program? These questions have been asked to us by so many doctors. So let's start with FCPS. In FCPS training program, the trainee they don't get paid by CPSP. They get paid by hospital. After passing the exam, part 1, the hospital appoints them and it's their choice whatever money they want to pay. So CPSP, they don't pay money to the hospital. That's why the hospital is not very much accountable to the CPSP. Although they get the guidance from them, they have to do the tick boxes, but CPSP has got not much influence, and this is the reason why the training in Pakistan is not standardized. Someone is getting trained in Aga Khan is different. Someone is getting trained in government hospital is different. On the other hand, in UK it's opposite, where the deanery, the Health and Education England, appoints the trainee. They pay the trainee and they send the trainee to the hospital. So this way, the hospital is accountable to the deanery, and this is the reason why they try their best to deliver as good as possible. Otherwise, the deanery will withdraw their trainees, and this will bring a bad name to the hospital. So you understood these two pillars, isn't it? Where a trainee gets either paid by the CPA, by the training program like Health and Education England, or on the other side in Pakistan, they get paid by hospital. Now, in both these situations, where a trainee gets a minimal amount of payment, a salary by either of these two, it is funded by these two institutes where the trainee gets paid. To get this minimal amount of payment, the trainee has to go through a very strict entrance criteria. They have to go through all the entrance tests, all the audits, all those kind of big list of English in part 1 and all that. As a result of that, hospitals gets only few percent of the people who they get trained, because hospital doesn't want to invest more fund on them. Deanery has got certain capacity. They cannot train more than certain people because of the finance. So for example, in out of 900 hospitals in UK, the training seats for emergency medicine in ACCs were 350 or something. So these are the two situations where the trainee gets paid either by the hospital or Health and Education England, but they have to go through a strict competition. As a result of that, more than 95% of the patients, the doctors, they get left out. To bridge this gap, someone has to come in. To bridge this gap, someone has to literally step in, and that's what LGEM did. London Global Emergency Medicine is the first ever kind of self-funded postgraduate training program, to my knowledge so far. I still don't know that any other country has started something like that. Now, what is this idea? This idea is exactly the same idea when the first ever private medical college came into being in Pakistan in early 80s. So when the first medical college, I know that Aga Khan University also started in the same time, but as an individual, as a person, the first ever private medical college was Bakai Medical University. Professor Bakai was the first person who broke this trend, and he set up the new trend. He broke this myth and he made it possible. He said that, okay, if someone doesn't get 90%, still he is able to become a doctor. Still he can become a doctor. So a person like me who went to Bakai, who has got a small, little bit lower percentage than the national merit, I became a doctor, and then I went and I trained 1,000 more doctors. So the idea of Professor Bakai went like a wildfire, and now today we have 200 medical colleges all across Pakistan. So this idea was also criticized badly in the beginning. For 20 years people has to get tortured with this kind of comments. Oh, they are paying money and they're becoming doctor. They are self-financing themselves and they're becoming a doctor. But finally, the world is accepted. Now we have so many great private medical colleges which is producing more than 20,000 doctors all across Pakistan. Similarly, there was a need to establish a privately funded postgraduate training program as well, where we can accommodate 90% of the doctors who couldn't join the national training program because of any reason. So let's put it this way, that or same goes with the private schools, uh, where they are more accountable. Where if you put the child to the private school, they're more accountable. Now, what is this LGEM? With this LGEM, usually, so Health and Education in England has to pay like £50,000 a year for CT1 or CT2 to be get trained by the hospital. On the other hand, the hospital is paying in Pakistan certain amount of money, and either they're training them or not training them. This is a different debate. But in LGEM, the doctor fund their own education. The trainee invest their own money, and that money is so negligible. If you compare them with the pleb journey, with the USMLE journey, or any other journey, this is just a peanut. And compared to UK spending like £50,000 a year, LGM trainee is spending like 70, 50 pounds a month, and maybe 1,000 or 1,200 pound a year, which is nothing. Every hospital in NHS has got 800,000 pound budget for SHO training. So this idea of privately self-funded education as a postgraduate training first time is introduced by us to own the non-training doctors, to make sure that we can train them, we can actually include those who were left out. Now, I hope you understood that what is this main training model. In Pakistan, trainees gets paid by hospital. In UK, trainees get paid by Traineee. So of course, the trainee has to go through interviews and strict scrutiny. So 90%, 95% cannot join the training program. Those who are left out, there was no other option for them. So we came with the privately funded program. Now, what is the importance of private education? Is it exactly the same as the private education in undergraduate, private education in school, where you are more accountable, where you have to deliver the results? As a result, if you see, and if you see the last 2.5 years, LGEM has conducted nearly 500 lectures. Not a single lecture was delayed, not a single lecture was cancelled. And all those faculties were UK trained consultants, senior consultants who were training doctors in Pakistan. As a result of that, in Pakistan, more than 100 doctors have passed Royal College Emergency Medicine exam. You cannot imagine that in last 20 years, Pakistan could not produce even 20 Royal College EM exam successful candidates. But in last 2.5 years, 2 years, we managed to get them trained. We trained them for 100 procedure workshop. We trained them for ultrasound workshop. We gave them nearly 400 hours of teaching. We arranged a lot of seminars for them. So as a private organization, we are accountable, we are answerable, and we are bound to give the results. And this is the reason why now LGEM is grown like a wildfire. We have 400 plus trainees all across the globe. Very soon, this number will go to 1,000, 10,000s. And I request, like Professor Bakai broke this myth and set up a new trend, I request all other institutes, Aga Khan, Ziauddin, Liaquat, to please start something like this and make sure that, we can cater the need, we can cater the demand of 90% of the doctors who were left untrained. Similarly, Professor Bakai did, and all of a sudden now everyone thinks that, there is a need of private medical college. Now in Azad Kashmir, we have 3 private medical colleges, which is a big thing. So, exactly the same way when private medical education was criticized, exactly the same way we are getting the criticism from the people who think that, oh, how can you become a trained consultant? How can you become this? How can you do that? And we have proved it. And you can meet my trainees, you can compare their learning outcomes, you can see where they stand, and you can compare them with the UK trainees or Pakistan trainees. I'm open for that. So this is what the whole idea I'm trying to establish, that please understand these 3 models where a trainee gets paid by the Health and Education England. On the other side, a trainee gets paid by the hospital. And the third model which we gave is where the trainee fund their own education, and there's no harm in it. A trainee can invest a small proportion of their income on their professional growth and professional development. If you go and see my trainees, there is 12 years gap, 13 years gap, but still they passed the exams. There is a girl who had an 8-year gap with the 3 kids. She passed MRChem primary, intermediate. She went for OSCE. There are doctors who passed full MRChem within 18 months. I'm here not saying to please go and buy my course. We really don't want people to be all coming towards one institute and joining thousands and thousands of applications. Please don't do that. We are saying all the other institutes to please come forward and bring some models similar of self-funded education, and make sure that we train other 90-95% of the doctors who were left out of the system because of various reasons, financial, social, kids, physical health. We should not leave them behind. So there is always a vacuum. Rather than criticizing any institute who takes a step forward, you come forward and join, and you bring the similar model, and teach and train thousands of other doctors who makes the major workforce in any hospital. So this is all about LGEM, and I hope I gave you a very clear, a very honest, and a very comprehensive comparison of training FCPS, Health and Education England, UK training, and what is LGEM training program. All training programs are good. There's no right wrong answer. It's just who you are and what level of competition you want to fight. If you really are someone who wants to go for USMLE, Pleb 1, Pleb 2, you want to go for FY1, FY2, you want to go for training competition, it's fine, go for it. But if you are someone who cannot afford this training at this moment, if you are someone who cannot leave your city, if you're someone who cannot leave the country right now, if your parents are not, there are social commitments, if you are not in a situation to leave your job, then there is an option for you, which is you can self-fund yourself for a private postgraduate medical education and training and become a qualified consultant. And if someone has a doubt about my training, our training, please, I would say, bring your trainees. Anywhere in the world, if you're in Australia, America, please come and compare. Rather than saying a criticism, come and sit with us, talk to my trainee, bring your trainees, and see how much difference we have made to this medical education. I'm not speculating, but I'm thinking that the time will come, the world is going to follow this model. The world has to follow this model of training, because no academic institute can fund 90% of other doctors. Hospitals cannot accommodate 90%. The trainee has to fund themselves, and we have to create the opportunities for them. I hope I gave a very comprehensive understanding about FCPS training, UK training, and LGEM training program. Wish you all the best. Thank you very much, Dr. Ashfaq.